Hi everyone, I'm Congresswoman Grace Meng. I am chair of CAPAC. CAPAC stands for the Congressional Asian Pacific American Caucus. We have lots of caucuses in Congress. Caucuses are like clubs in high school, and we are so honored to be part of CAPAC. CAPAC is 82 members strong this year, and we consist of Asian Pacific American, Native Hawaiian members from all over the country, and also Congress members who represent significant AA and HPI communities. We're so excited today to have a few special guests with us. We have our vice chair of the caucus, our highest ranking Asian American in the House Democrats, Ted Lieu. We have Mark Takano, who is ranking member of our Veterans Committee, and our shining star, Jill Takuda from the great state of Hawaii. And we'll have more join us. But maybe I can turn it over to our vice chair. Ted, what happens in a few hours?
Well, first, let me thank Grace Meng for her leadership as chair of CAPAC, and so honored to be here with Joe and Mark. We are less than 10 hours away from a federal government shutdown. Democrats are here in Washington, D.C. We're working, we're ready to fight for the American people. We want to cancel the cuts, lower the costs, and save healthcare. And where are Republicans? They are on vacation. We're one day from a government shutdown, and they're on vacation. We're asking Republicans to come back to D.C. so we can prevent a Republican-led government shutdown. And we need to make sure that we work for the American people, not for special interests.
Thank you so much. Families all across the country, especially in our A and HPI communities, are really scared. You know, right now, I've been here for many years, but I've never been here at the cusp of the government shutting down, and the other party, which happens to be the party in charge, is literally nowhere to be found. They are not even in Washington, D.C. We're hearing a lot of news, though, about something called a CR. Can anyone explain what a CR is?
Well, a CR stands for continuing resolution. And what a continuing resolution is simply that we're continuing to spend based on last year's allocations, the previous fiscal year's allocation. The fiscal year ends on September 20th, and we're supposed to have the allocations or the appropriations done for the next year. When Congress doesn't get all that done, they go to a temporary spending bill, supposedly to continue discussions on how we get next year's appropriations or allocations done, 2026, the 2026 fiscal year. Well, we don't have an agreement on next year's allocations, and so we're supposed to go to a CR to temporarily fund the government. The problem is that this CR is not a clean CR, as our Republican colleagues claim. It's not just simply about that. It is a continuation of a bad CR that we did back in the spring, where they continue to cut healthcare for Americans. And that's why we Democrats are saying, look, we're not going to support a continuing resolution that hurts the American people.
Well, I think, Mark, you were instrumental in passing the PACT Act. And so when we take a look at one of the most egregious things that Republicans did in passing that dirty CR in March, it was actually reneging on our obligations and our commitment to those who have literally sacrificed and served, and taking away those resources, those appropriations for the PACT Act was included, if I'm not mistaken, in.
They didn't approve the
next batch of funding.
The next for fiscal year 2026. And Jill, I know that there are so many service members and veterans that live in your district in Hawaii. You should know that the Big Bad Ugly Bill, which this CR is definitely a kind of a companion piece of legislation. That Big Bad Ugly Bill, which is now the Big Bad Ugly Law, cut Medicaid. 10% of all Medicaid recipients are veterans.
Mhm.
Of the 19 million Americans that depend on the enhanced tax credits to help them afford to buy insurance policies from the health exchanges, 600,000 of those 19 million are veterans. And you know what? I bet you have a lot. I've been to Hawaii. I've seen all of the small businesses that you have there.
Yes, we have many.
So many small businesses depend on health exchanges to buy their policies and those premium tax credits to help them afford it, because in my district, many small business people, entrepreneurs that aren't part of employer-based health insurance plans of 500 more employees or more, or 50 or more employees, they depend on the health exchanges. And so the AA and HPI community, there's a lot at stake for us in trying to cancel the cuts that the Republicans have made to healthcare, especially to these health exchanges and the enhanced premium tax credits that help our constituents afford healthcare.
And these cuts go very deep. You've got over 15 million people that are going to lose Medicaid. You have $500 billion of cuts barreling towards Medicare if things are not resolved. And you also have ACA tax credits that the Republicans are discontinuing. That's going to throw off millions more people off the ACA and increase premiums for a lot of people. And the issue with healthcare is if someone gets really sick and they don't have healthcare coverage, well, guess what? They're still going to get treated, because we don't let people die in America if they go to a hospital. So they get treated at the hospital, at the emergency room, and then those costs are passed along to everyone who has healthcare, thereby increasing everybody else's premiums as well. So this is very bad for everyone across America in terms of healthcare.
You know, and I think that uncompensated care is what's scaring not just small rural hospitals and providers in remote areas, but also big institutions as well, to Ted's point, where the sickest of the sick, because they haven't gotten the preventive care, will end up in the ERs instead. But since we are CAPAC, I feel like we have to have a little bit of fun. So we've been asking the question, where are the Republicans, right? Well, let's address this in a language that represents us, that we understand. So, aya ihe na Republicans. Aya ihe na Republicans. Where are the Republicans in Hawaiian? So that is the question that we're asking from Hawaii's 2nd Congressional District. Anyone want to take a stab in another language?
We made a sign too. This is in Chinese. 共和党在哪里? Republicans, where are you? We're looking for you. We're ready to vote to keep our government open.
By the way, just so you know, although the ACA and Medicare and Medicaid affects everyone in America, you should know a significant portion of Asian Americans, Native Hawaiians, and Pacific Islanders rely on Medicaid, over 4.5 million, and then another 1.5 million Asian Americans rely on the Affordable Care Act. And so we want the Republicans to come back from vacation and keep the government open.
Yeah, it's really scary because you keep hearing about how we just can't vote for something that would let these tax credits expire. What happens if these tax credits expire? 156,000 AA and HPI people will no longer have access to zero premium plans. So this is really something that will impact a lot of people. As Ted said, 4.5 million in our community get their health insurance through Medicaid. That's 1 out of 5 Asian Americans and 1 out of 3 Native Hawaiian and Pacific Islanders that rely on Medicaid. 80% of our community in this country live in the 39 Medicaid expansion states and in Washington, D.C.
I mean, those are some scary stats. You know, we're not even close to Halloween yet. And that really is the trick, if you ask me, the Republicans are trying to pull on this country. But it's a scary reality. We have over 3 million small businesses that are AA and HPI, as Mark said, in all of our districts. And many of them, small mom and pop stores to begin with, that branch out bigger and bigger, have a few employees, they rely on the marketplace for their coverage. And in a few days, they're gonna start to get a letter to say, by the way, this is how much your premium is gonna increase. And I've heard numbers as high as 75% increases in their monthly premiums. There's a lot of people who are gonna go without. There's a lot of people are gonna say, even from my keiki to my kupuna, from my youngest to my oldest, can I afford that and still keep a roof over my head and food on the table?
So people are gonna have to choose, Jill and Grace and Ted, they're gonna have to choose between having coverage for their family, health insurance for their family, or paying for their food. And without health insurance coverage, what does that also mean? It means the cost of prescriptions. Have you ever tried to buy prescriptions, just based on the over-the-counter, not over-the-counter, but what do you call that? Just the market price for drugs. If you don't have an insurance plan that has negotiated that price of drugs inside your plan, I mean, it's the difference between like $36 for the eye drops that I need to $300 a month, and many people are on multiple prescriptions. Some people who have kids with allergies, you need that EpiPen. That cost is a huge amount if you forgot ever get cancer, one cancer drug can be like $15,000, $20,000 a month. That's why people get health insurance, and that's why going without it is a huge, huge, scary thing for Americans.
And to your point, we're not just talking about hundreds of dollars. We're talking about simply more amounts of money that people would have to pay. The Kaiser Family Foundation did these studies, and they show that for a 60-year-old couple who makes approximately $80,000 annually in salary, their insurance premiums under the Affordable Care Act are going to rise to over $13,000 in additional costs if the ACA tax credits are discontinued by Republicans. So this is significant amounts of money, and it's going to cause, as Mark said, people to choose between having healthcare coverage or having a roof over their heads or some other basic necessity.
Yeah, it's a really scary time. Jill said it's not Halloween yet, it's almost Halloween. And while we are swallowing these bitter pills, Jill was kind enough to bring some treats as we prepare to
So
celebrate
there's
Halloween.
tricks and there's treats. Yes. Is this
Show
the
us
time?
And
what
a
you
leather
got,
pineapple.
yeah.
Oh my God.
Yes, this pineapple, this is the mystery pineapple. I went to some crack seed stores back home, small mom and pop businesses that have been around for generations, taking care of us kids, candies of all sorts. So you can pull or you can choose, but we've got everything.
I got a gummy pineapple.
That's
White rabbit.
a wasabi white rabbit.
Wasabi white rabbit.
I'm gonna need something
Okay.
sweet as we
I
head
call-
into the
I
shutdown.
call Jill the queen of omeyage. She never leaves Hawaii without like suitcases full of omeyage.
Totally.
Just little gifts, but as we think about what's in this pineapple, there's a lot of businesses in our hometowns that take care of us, and they have for generations, right? And think about the fact that we can't take care of them if we're cutting their health insurance. And I'm looking at how many people are gonna be uninsured in my district, and over 25,000 people will become uninsured if we don't renew these tax credits. Probably even more, tens of thousands more. We'll probably lose Medicaid as well. And so think about all those auntie and uncles who took care of you. Right now, they're depending on us to hold the line. Take care of them.
Yeah. And I want to thank so many of you who are tuning in today. I know that some of you had even reached out. You have questions of your own. So here's some of the questions. I don't know if Ted and Mark, if you want to take a stab at some of
You
them.
take a
Alright.
treat
If
and
it's
you
too
take a
hard, you
question.
can put it back and take another question. We won't judge you.
Why did Trump cancel his meeting with Hakeem Jeffries and Chuck Schumer only to reverse course? Well, that's because the president has no strategy and no plan. I'm not even sure he understands what's in these bills that he signs. He actually went to the Republican caucus earlier this year and told them, don't F around with Medicaid, except that's exactly what the Republicans' big ugly law does. It completely messes up Medicaid, has deep cuts to it. It's gonna throw off 15 million people off of Medicaid. So that's why Donald Trump does what he does, because he doesn't really know what's going on. And so we urge the president to please focus and please work with Democrats and Republicans to prevent the Republican shutdown. Republicans control the White House, the House, and the Senate, and the House Republicans today are on vacation.
Well, the question that I got was, somebody has asked, why is Trump threatening to fire thousands of civil servants if there is a shutdown? Why, and hasn't this administration been firing federal employees all year long? On that last point, yes. He's been looking for ways to fire employees. He first went after thousands of probationary employees that did not have to go through any kind of for-cause dismissal process. And the courts actually reinstated many of the employees, but the Supreme Court backed Donald Trump up on some of these firings. But you know, they all say that they're for efficiency, getting rid of waste, and implying that it's the federal employees who are the inefficiency and the waste. But the truth is, who answers the call when you need a question answered about Social Security or Medicare when you're having a problem? Who is it that you know, processes all of the PACT Act claims for your veterans benefits? I could go on and on. Who runs the Federal Park Service when you want to go on vacation in one of our national parks? The park rangers. Look, Donald Trump has already, his cabinet officials have fired already so many people. But the idea that you're going to use as a bargaining chip, if you shut the government down, or if the government shuts down, we're going to fire a bunch of people. That makes no sense at all. That was like when my little brother, my youngest brother, would get mad at my next youngest brother, who would kind of bully him and say, well, you know what, just for that, I'm gonna go break all my toys. You know, well, you know, that makes a lot of sense. You know, threaten your older brother who's already, you know, bullying you, to like, you know, I'm gonna break all your toys to get him to stop. Oh yeah, let's threaten to you know, if this government, if you don't vote with us, if you don't do us what we tell you to do, we're gonna fire a bunch of federal employees. That is, and hurt the American people more. That is a real strange thing for a president to do.
So I've been on this journey today to see if I can find House Republicans around the Capitol. I have to go now and go see if I can find other House Republicans. Check out my social media. You can see me trying to look for House Republicans. But this is a 24-hour live stream, and Grace and Joe and Mark are going to continue to be here. And thank you so much for watching.
Good luck, Ted, finding them.
Thank you.
If you find one, let me know.
I will. Thank you.
Maybe I'll get you a prize.
Well, so much of this is so heartbreaking to hear. These are not just statistics and numbers. You know, they're stories behind real people, real Americans, from Republicans to Democratic families to everyone in between. You know, we've been meeting with a lot of folks who have taken time out of their busy schedules to come to Washington this week. They're telling us how important these tax credits are and that they are literally a lifeline. We heard from a woman today who was diagnosed with cancer. She had a cough. Her name is Lauren. She had a cough. She went into the doctor's office and came out and was diagnosed with stage 4 cancer. And thankfully, the Affordable Care Act was able to help her. And even though the Republicans tried to repeal it, it did not work. And they tried on the day after she was diagnosed. And so we're hearing so many stories of folks who are here in Washington, but also people that we know from back in our districts. I don't know if you've heard of stories and if you have any you want to share with our country.
Do you have any, Joel? Oh, well, I can talk about the people who are on Medicaid. And you know, we heard today from Teresa. Her name is Teresa. She's from New Jersey. I remember the state she's from. She had 2 young 12-year-old boys, they sound like twins, who are autistic. One is pre-verbal, the other, they both need a tremendous amount of help. Medicaid for a working class person who has disabled children is indispensable. The costs for taking care of children who have autism or any kind of disability is just, just on a working class salary is just not enough. They just could not afford it. And you know what would be horrible is that her sons would not be able to reach the potential that they could. And as she said, that we all, through Medicaid and programs like it, can enable every American to be a contributing member of society. She talked about the wonderful gifts that each of her sons have. And without Medicaid, not only is there medical help not covered, but also Medicaid pays for the specialized education that the public schools just simply cannot provide. Now, I can tell you also stories about Medicaid parents who need Medicaid in my own district. I've visited with them. I've done videos on my own Facebook page. You can go there and look for that video that I'm doing with that I have with parents of an autistic child. But the parents of kids with disabilities, they're terrified about these cuts. And let me say something. I mean, Teresa told me something very interesting today. She said, "Look, it's not just people with kids that have autism. You might have a kid that has severe allergies and needs an EpiPen. And if you are in a certain income level, and we're not talking like super poor, we're talking about people that are working. You know that most of the people on Medicaid actually work. That's the other thing. That Medicaid pays for that kind of medication for kids that aren't, like, if we don't think of them as a completely disabled, but may have a very severe allergy that needs.
Well, that's life-saving, right? When you think about an EpiPen.
Yes.
And you have any kind of allergy, and as parents, that is probably the scariest thing, that if your child needs medication, needs treatment, right, needs to see some kind of doctor or specialist, and not having the resources and means to be able to provide that to them. These are impossible choices, essentially. I think, Mark, what you're hearing, we're all hearing, Grace, in our communities, the impossible choices that people are going to be faced with if they have to double their premium costs to keep themselves on the marketplace, or if they lose Medicaid, or even more. Let's talk about the fact that food is medicine, and for the $200 billion in cuts to SNAP, BBT, right, that Republicans did in that big ugly law, you are now going to see people hungry, without health care, making impossible decisions. So one of the things I'm actually asking my constituents as I go out, and I think we'll start to see more roll through, is especially as you start to get that notice about how much more your premium is going to go up, if you're able and willing to share that with us. Talk about your situation. Are you a small business owner? Are you underemployed so you couldn't qualify for health insurance? Are you, do you have kids? Are you caregiving for a family? Just give us that description of what life is like, and how now having to pay hundreds and hundreds of dollars more in your premium a month, what that's going to do to you. And if you're willing, share the choice you made, because I think for many, they're going to pick up that bill and they're going to, I just can't. I can't afford it, and let's hope I don't have to go to the emergency room, because that would be the only option for some of them. So if you can reach out to our offices, share those stories, and let's share those numbers, because I do think Republicans think we're making this up, but it's a real situation millions of Americans are going to find themselves in as they look to see, what can I afford, what can't I afford?
Yeah, I agree with you. Share those numbers. We know that those notices are going out in California tomorrow, the next day. The next few days, all the health exchanges in the states where you have health exchanges, they're going to be sending out notices about the premium increases, because Congress hasn't acted. So they have to assume that these premiums are going to increase. I've heard they in some cases double, in many cases triple. It's just going to be unaffordable. Grace, I want to bring up one thing that really outraged me yesterday, is when I saw this AI generated video sent out by the White House, an official video sent out by the White House communications team. I think it was either before or after Hakeem Jeffries and Chuck Schumer, Senator Schumer, went to the White House to a meeting which was supposed to happen last week but was canceled. The president instead went to the Ryder Cup, which is a golf tournament. All this time could have been spent negotiating and talking with the Democrats, but they did have this meeting yesterday. But you know what? There was an AI generated video which depicted Hakeem Jeffries in a sombrero and a serape, and they had Chuck Schumer. They manufactured through AI, generated AI sound, Chuck Schumer saying things like, well, the Democrats, no one votes for the Democrats, and we need to, fight for health care for undocumented, well, he said illegal aliens. I've got one thing to say about this. I want everyone to be clear that in no way is someone who's undocumented able to be eligible even for Medicaid. They're not eligible for the enhanced premium tax credits. It is a bald-faced lie that the White House is using. But you know what this is, in my view, as an AAPI? It is just a horrible use of racism by this president to tell lies to make Americans mad that their taxpayer money is being spent on non-Americans on these healthcare programs, which is not true. So he's trying to distract with this kind of a video, distract from who Americans should be mad at. Who Americans should be mad at? They should be mad at Donald Trump and the Republicans because they're cutting healthcare for 35 million Americans while they're preserving tax breaks that worth trillions of dollars. Americans, if they could focus on that, would be mad about that.
Trillions of dollars in tax breaks for billionaires.
Billionaires, excuse me.
Let's be clear who they're fighting for, right?
Yes, billionaires with tax credits. And then, you know what? They didn't even, so they wanted to pay for these tax breaks in the big ugly bill by cutting nearly $1 trillion. If you add up the 900 billion plus the 2 or 3, what was the number for SNAP? You're on the
$200 billion.
$200 billion.
Yes.
So it's $1 trillion. $1 trillion in cuts to programs Americans need in health and in nutrition, all for what? Trillions of dollars in tax breaks. The cuts didn't even pay for that. So you know what? We're on course for even more cuts to healthcare, cuts to Medicare, worth $500 billion, $500 billion over 10 years. That's what the Republicans have put us on course to. We need the course correct.
Yeah. Well, thanks, Mark, for joining us. It's such an honor to have your voice, and you're probably going around listening to, visiting impacted people, and maybe good luck in case. Let us know if you run into any Republicans.
Also, if I run into Republicans, I gotta just calm down. I get so mad talking about.
All right, take more candy. Take more candy.
You know I can't have.
I know.
All right. Bye.
See you later. And to Mark's point, it really was upsetting to see what the president of the United States, a world leader, put out in mocking Hakeem Jeffries and Chuck Schumer. In the midst of, by the way, a very precarious situation where the two parties are trying to, in good faith, come together and put together a budget, and you put out a childish is actually an adjective that is offensive to even children, because even children, we are both moms, we would never allow our children to put out something like that, much less the president of the United States, a racist and manipulated video that he spent time, I don't know if he did it himself, but putting out there when he should be figuring out how to save healthcare.
Well, I mean, when I saw that, that's the first thing I thought as a mother, was Trump's mother should be mad. She should really be mad, because that was offensive behavior. And I think to Mark's point, and we've seen this too often in CAPAC, you can't have someone at the highest, literally the highest level of government, normalizing racism. Now we know, and sadly, this is not the first, second, third, 100th time that this president has normalized racism, has said racist, discriminatory things. We were on the receiving end of it during the COVID pandemic, Kung flu, literally verbiage he threw out at his own cabinet members in racist, discriminatory terms. So this is nothing sadly new that we are seeing. That being said, we can't take it. It is unacceptable for anyone, president or our children, to be doing things like that, because that puts all of us down. In the midst, by the way, we're literally in the middle of Hispanic Awareness Month. I mean, this is what he do. It's insult, injury, and he keeps repeating itself. It cannot be normalized. And I think when we sit here and talk about what we want for the future. We want a government that's open. We want a government that's compassionate, that sees all of us. We want a government that recognizing that healthcare is a right too. And so, it's a long road ahead for us, but I notice your bowl has more questions. We can either eat lots of snacks, which I have plenty of, or
We could do both.
we could do both. We could have snacks
You
and
Your snacks and answer questions from fellow Americans.
Okay, I like
Let's
that.
see. Let me try one. Well, we kind of touched on this, but U.S. Democrats are all back in the Capitol right now. But where are House Republicans? Why are they on vacation? Yes, as Ted said earlier, we are all back in the Capitol. Our leader, Hakeem Jeffries, and our members want to be here. Like I said, I've been here for over 10 years. I have never been sent home by either a Republican speaker or a Democratic speaker when we're supposed to be in Washington voting on this budget. But last week, Speaker Johnson suddenly announced that this week's votes were canceled. Why would you cancel votes on the day you're supposed to vote on our congressional federal budget? I don't know where they are. I know that they're not here. We don't have any votes scheduled tonight. So there's going to be a shutdown unless a miracle happens and they all come back in the next 6 hours.
And Grace and I were on the floor just a little while ago when they had the Performa session. We were all there, and if you see any of the pictures from that, literally half the chambers, their side was completely empty. We were all present, ready to vote, ready to start doing the work of the people, but they were all MIA. My question, and this is going to be different for everyone, the answer, will your offices be open during a government shutdown? And so the answer for our office is all of our team has been deemed essential by me. We know we've got a lot of work to do. I know how difficult this is going to be for all the members of my team. I love them. I'm grateful for the service that they give to our constituents. Should it look like it's happening, we'll actually be launching a page on our website that talks about, just answers some FAQs about the shutdown, give some, idea of what might happen. Although I think, as Grace knows, it really is administration to administration, and we're not sure what this administration will do, what they'll keep open or what they'll close. We've kind of known in the past what stays open, parks, but limited service perhaps with, custodial and other types of things. But we really know nothing except the threats that they have been putting on the American people, like mass firing. So our office will be open. Please call us if you need help. Should we be in a shutdown, look to our website, tokuda.house.gov, and we will have a landing page there for you to click on. But Grace, I don't know if you want to share what the situation might be for you.
Yeah, we are in the same exact situation. I've made the same decisions for my team because if there is a shutdown, Americans are going to be really scared. This may seem like something very far away, a concept that doesn't relate to everyday people, but it totally does. We will start seeing the impact soon. We don't know what exactly the timeline will be, but it could help benefits it could impact and hurt benefits for our veterans, Social Security program, Medicare. This is something that is really scary. If you are traveling, it could impact our TSA agents and their ability to do work. Food inspections. If you want to eat food and not get sick, we need to keep the government open. We're so grateful to have one of our key members in our Asian caucus. One of our executive members, Congressmember Dan Goldman, you may have seen him on TV a lot. He has an extensive resume and spends a lot of time, we're very fortunate, reaching out and speaking up for our Asian American, Native Hawaiian, Pacific Islander communities. So, hi Dan, we're talking about a potential shutdown.
Yeah, no, and thank you for doing this. Thanks for having me. It's always great to get together with you all as we try to figure out how to navigate our way through this and to help our constituents do that. I am lucky enough to be in Lower Manhattan, and I represent the historic Manhattan Chinatown, and I also have a big chunk of Brooklyn with a ever-growing Chinatown, and I spent a lot of time in the communities, and the impact of the tariffs is devastating. The impact on small businesses has been crushing, and now as the Republicans are gearing up to continue their cuts on health care, when such a large percentage of the AAPI community depends on Medicaid, uses the ACA, it's going to devastate the communities. And I think it's great that you brought us together, Grace, to highlight the really disproportionate impact of all of these Trump measures, Trump policies on Asian communities, and how devastating it is to not only the communities and the individuals, but the entire neighborhoods, the full fabric of society that it really depends on it.
Yeah, definitely. And Dan, we've been talking about, what is a CR? What does a shutdown mean for America, for our constituents? The impact, like you said, disproportionate impact on our AA and HPI communities all around the country, in Republican areas, Democratic areas, and everyone in between. This will spare no one. We have some questions from the public that were submitted. Feel free to answer that.
I'm also going to see, just for the viewers that are from his district, maybe if he wants to answer the question about his office situation.
Yeah, will our offices be open during a government shutdown? We will be open. We are sort of responsible for our own staffs and somewhat separate from the executive branch. And I have asked my staff to continue to work, even though they will not get paid. And the promise of retroactive pay is important. But frankly, if it gets to the point where people are struggling, I think it is absolutely essential that our staff and our offices are open during these difficult times when people are need advice, need questions, that I'll make sure whatever way is necessary that everybody is not, or my staff is not adversely impacted, so they can keep working, because that is absolutely vital.
Yeah. And we not only have been receiving questions from the public, but also people have been sharing our stories. As you know, they've been coming to Washington, they've been contacting our office, and I have a bunch of stories. We literally don't have enough time just to hear the stories that I, as one office, have received, but I wanted to share two quick stories about how scared people are. One of them, she is she works at a nursing home. She is desperately worried for her residents. Where will they go if extremist politicians slash the very program that is needed, this healthcare program, just to pay for huge tax cuts for their billionaire donors? Not only would my residents lose access to their health care, their medicine, their meals, their activities, friends, and caregivers, but they would lose the only home they now have if these extremists have their way. I'll save the other stories for later, but that is just one example. Think of anyone you know that lives or works at a nursing home. It could be your own grandparent, it could be an elderly neighbor's family. This has real impact on people.
I would just add one thing to that story that I hear a lot in the community is the big ugly bill we know is yanking Medicaid away from as many as potentially 15 million Americans. And with these premium tax cuts on the Affordable Care Act, which is a fancy way of saying that it's a way to subsidize it for people that have lower incomes so they can actually get health insurance, that is understandably and deservedly getting a tremendous amount of attention. But the one thing that is not getting enough attention, and you mentioned nursing homes, but it's also federally qualified health centers. These are community-based health centers that are in communities of need where there is a greater necessity for local health care and where many people cannot get preventative health care. And these community health centers provide wraparound preventative health care, and they are absolutely essential to our healthcare system. And I've been talking to a number in my district where one of them told me, for example, that 5% of their current patients do not have insurance. But that if this bill is not fixed, as we are trying to do right now, that goes up to 22%. They are going to have to cut a tremendous number of doctors and services and additional departments like dentistry or behavioral health or things that are so important to the holistic view of health these days that make such a big difference. And so that's going to impact so many of our communities, even for those who still will have health insurance, because they won't get access to the best care and the most variety and quantity of care.
And I think what Dan mentioned is important. In Hawaii, we have a lot of federally qualified health centers. We have rural health centers. We're rural and remote, and I co-chair the Bipartisan Rural Health Caucus. And one thing I've told people is, even if you don't have Medicaid, even if you're not on the marketplace and you have private pay insurance and you think you're fine, if you live in rural and remote America and other places, if these doors close, if our FQHCs, our rural health centers, small providers, small rural hospitals start to shut down, that's care eliminated for everyone.
Mm-hmm.
Every single person. That's taking away healthcare access in places where we're already short to begin with. And don't let them fool you that somehow that $50 billion pot, which is a pittance compared to the trillions in tax breaks they gave the billionaires, don't think that this little pot somehow is going to solve everyone's problems. The real way we get to making rural hospitals more sustainable is to cancel the cuts and to make sure we can continue these enhanced premium tax credits. That's how you keep rural hospitals more whole. And then we can work from there. But a small bucket to ease their pain does absolutely nothing. And everyone, as Dan was saying, everyone's going to suffer if people start to close their doors because they can no longer afford the uncompensated care that's coming through the doors, or they're getting less in reimbursements.
And add on to that, because you're exactly right, and the trickle-down effect is even greater because the costs of everything are going to go up just by basic economics, and not having as many places to get various different services is going to make the demand for them greater, is going to make the cost go up. And so this is going to have an impact on every single American. Do not think as you sit there, oh, well, I don't have Medicaid and my Medicaid won't be taken away, or I'm not on the open marketplace, so this is not going to affect me. That is wrong. It is going to impact everyone. And if you have to go to the emergency room, what you are going to see is that what used to be a 2-hour or a 4-hour wait is potentially going to be a 2-day wait. And that's what I've been hearing from the hospitals in my district, that because so many people are not going to have insurance, they still need to have their health addressed. And so rather than going to their doctor in advance and getting preventative care, which we all know is much less expensive and more effective than back-end emergency room care, they have no choice but to go to the emergency rooms, and the emergency rooms have to take care of them. So that's actually going to increase costs overall, make waits longer, and really debilitate our entire healthcare system.
So I think we're very clear. There's a choice. This doesn't have to be an inevitability, right? Cancel the cuts. Let's make sure we expand, make permanent, quite frankly, in my humble opinion, the enhanced premium tax credits, keep people insured, keep people cared for. That's how we go forward. But there is a choice. And I think the false choice that Republicans are giving the Americans is it's my way or the highway. That's, first of all, never how you negotiate. Obviously, I think you know that best. But also, Americans have to understand there is a choice, and that's what we're fighting for, a better choice for Americans.
Right, and think about it this way. The Republicans rammed through these disastrous cuts that we've been talking about without any Democrats because they could. And so we pass appropriations bills. Almost always they have to be bipartisan because you need to get 60 votes in the Senate. Then what they do is they turn around and they use this little gimmick to cut out all the Democrats and cut so many of the things that we put into the appropriations bills. Now they're saying, oh, well, too bad, that's what it is now, so let's just continue it. And this is the first opportunity that we have had any leverage to weigh in on our views on these cuts. And so they have once again gone ahead, no negotiations, plowing through with their own bill, no discussion with us, and yet somehow they want us to vote for it and go along with them, which is absurd. It's just anybody who's in any negotiation would recognize,
Absolutely.
if you want me to sign on, you've got to negotiate with me and you've got to give me something that I'll give you something. And that's where we are. And yet they seem to think that we're not in that place, that we are with the big ugly bill. And what we're trying to do is say, no, we're not going to endorse the big ugly bill. We're not going to agree to these terrible, terrible healthcare cuts that you've made. We're going to stand up for the American people and for their healthcare. And we're going to make sure that we do until we fix at least part of this healthcare crisis that the Republicans have created.
So we just have a few minutes left, but we really want to thank all of you for tuning in. We know that you are all very busy, but this is important. As you've heard us talk about for the last 50 minutes or so, this is something that is going to affect all of us. And we just want people to know that we are here in Washington. We are ready to work. We all came back from our districts. We're literally here in the Capitol waiting.
Joe flew 12 hours.
From Hawaii.
No trains to Hawaii.
No.
Yeah.
Dan and I
Grace
had
and I, it's a lot
closer
easier.
commute. But we're all here from all around the country. So please, wherever you live, ask your congress member where they are. Ask them whether they agree with us or not. Are they at least trying? Are they here in Washington doing their job? Because our salaries are paid for by the taxpayers, by you. And you deserve to have your members of Congress in both parties here in Washington working for you to protect your health care. So thanks for tuning in. I don't know, Jill and Dan, if you have any closing comments.
I just want to send a really big mahalo out there to all of our federal workers, federal employees. If you see them, whether it be at the airport, whether it be anywhere, whether you're calling them on the phone with questions about your Social Security, you're trying to get a passport, will you just tell them thank you? Because imagine what they're going through, their families are going through right now with so much uncertainty, with literally the entire Republican conference out, not even seeing them as so important to be here and be present to get some work done. Thank these federal workers. Thank their families for the sacrifices they make, the things they do you don't see, but help you live your everyday life. So big mahalo to all of them, to all of our teams here, which we know it's gonna be a hard few hours, days, let's hope not too much longer than that. But we showed up for work. We need the Republicans to do the same thing too. And again, America, remind them there is a choice. There is a better way where we can protect healthcare. We can keep small businesses like our 3 million A&HPI businesses across the country alive, healthy, and well. This is a choice we're supposed to be making on behalf of the people. That's why we're here. Now we need the Republicans to come do the same.
And I think that's important. The Democrats are here in Washington 8 hours before the shutdown, ready to pass the bills, to keep the government funded, ready to do whatever is necessary. The Republicans are on vacation. That tells you everything you need to know.
Thank you for tuning in.